Hello and welcome to Wellness Melinda University Health's Living Whole Wellness Program, and my name is Dr. Olivia Moses. We are so glad you have joined us today, and we have a great topic for you. So today we're going to be talking about community gardens. And right now, if you're watching us live, it is summertime, and a lot of people have been interested in getting involved in gardening, and you're like, well, how can gardening, other than just plain nutrition, help a community? Well, we're here to talk about it, and we have two amazing guest speakers. But before I introduce them, if you are watching us live, don't forget that you can ask our experts here today, our guest speakers, questions live from your very own home. So go ahead and type into that comment box at the bottom of your screen if you'd like to ask our speakers some questions. So we have two special guests today. Our first speaker that I want to introduce you to is Dr. J.C. Belliard. He has actually been at the institution for 26 years. So we just want to thank him for his years of service here at Loma Linda. And he is the Assistant Vice President of Community Partnerships here at Loma Linda University Health. And we also have Karla Estudillo-Fuentes, and she is the program manager for CAPS. And she's only been here for 2 months, but was a student that we recruited out of our MPH program. So we wanted to thank Karla also for being here and for talking about this very important topic that I think all of us can get excited about. So without further ado, I'd like to introduce you to Dr. J.C. Belliard.
Oh, good afternoon, everyone. It's a privilege to be here and to be able to share a little bit of information. So I get the half of the presentation that is the not so good news, and then we'll end with the good news and some of the ways that maybe some of you can get involved. I'll go ahead and share my slide here. So both Karla and I work at the Institute for Community Partnerships, and the Institute is really tasked with making sure that our institution is both relevant and responsive to our community. But some of the things that I'd like to share with you today start with the bad news of chronic disease in our community. So 6 in 10 adults in our country are suffering from a chronic disease. If you really think about it, our healthcare systems have been created more for dealing with acute illness. I remember a physician once told me that he had gone to medical school. He said, JC, I went to medical school to cure disease, not to manage disease. But with chronic disease, you have a lot of disease management. And what we're seeing is that not only are 6 in 10 adults in the US suffering from chronic illness, but also 4 out of 10 adults have 2 or more chronic illnesses. So we see this in our hospital, we see it in our clinics, we see it in our families, and it's really a public health crisis in our country. If you look at bringing it home closer, here in San Bernardino County, 14.6% in 2017, 14.6% of adults were diagnosed with diabetes. And we know that diabetes really goes along with heart disease, hypertension, all the metabolic syndrome package that comes together that's tied to lifestyle. And unfortunately, San Bernardino County was the leading county in diabetes in the state. This marks an increase since 2016 in 1 year from 11.4 to 14.6% of diabetic patients. In 2017, the county's prevalence rate, which means how many people already have heart disease, was the highest among neighboring counties except for Orange County. But if you break down the county into cities and census tracts and zip codes, we have some of the worst health outcomes here in San Bernardino County. Also, hospitalization rates for heart disease in San Bernardino County was 85.1 per 10,000 residents, compared to the state level of 69.6. So you see the difference between the county of San Bernardino and the state, 85.1 to 69.6%. Now, some of the key lifestyle risks that we see are tobacco use, and you might think Living in California, we don't realize how much people still smoke. When you leave the state, you realize there's a lot more smoking going on. When you travel overseas, I remember going to a soccer game in Spain and thinking that there was fog that evening. It was the Barcelona versus Chelsea game, and you could barely see some of the signs, and it was all tobacco smoke from the people in the stadium smoking. So I was telling my son we probably lost about a year of life expectancy just by watching that game, but it was a good game. So tobacco use, even though it has been going down in our population, there are certain groups that have seen an increase in tobacco use. Women, younger college students. We also look at lack of physical activity. And you may have heard from your physician or your provider that you need to exercise more. But when we're talking to some of our community partners, our families in San Bernardino, they might respond, well, where should I do this? I don't have sidewalks in my neighborhood. The parks near, if I have a park in my neighborhood, it's not a safe place to go. It's just not a safe place to go out and exercise. Poor nutrition, which we're going to be talking a little bit more about, the food desert phenomenon, where you have a majority of food outlets are unhealthy foods or fast foods. You don't have access to farmers markets, to grocery stores. And then excessive alcohol use. All you have to do is look at the billboards in our communities. And when you look at marginalized communities, underserved communities, you see a lot more billboards that are advertising alcohol, tobacco, and products that are not healthy, fast foods. So what are these food deserts that I had mentioned earlier? It's basically when you don't have access to a grocery store or a farmer's market, which translates to you don't have access to fruits and vegetables and to real food. What you have access to is what they call food swamps a lot of times. And that is where you have a high level or a high number of fast food and liquor stores in your community. So according to a report that was prepared for Congress by the Economic Research Service of the U.S. Department of Agriculture, about 2.3 million people, or 2.2% of all U.S. households, live more than a mile away from a supermarket. And you might say, well, I live about 2 miles away from a supermarket. But if you have transportation, that's very different than somebody who relies on public transportation or has no way of getting to that supermarket that's 2 miles away. So some of the characteristics of food deserts is that they are often found in low socioeconomic communities, commonly found in Black and brown communities, and studies have found that wealthy districts have up to 3 times more supermarkets than poor communities. So before we start telling people you need to eat healthier, you need to exercise more, we need to look at the environments in which they live and how conducive those environments are. We used to have a conference here on campus called Healthy Communities by Design. And I remember this is what we talked about. Remember, Olivia? Mm-hmm. It was a yearly conference. I hope we can bring it back sometime. It was looking at the built environment and how our environment really produces a healthier population. So making the healthy choice the easy choice. And this is really what this is all about. So you can look at maps in the Inland Empire and look at these food deserts and where they exist. Up in the high desert, parts of San Bernardino City, and you can see where people don't have access to those healthy foods. And then one more thing that I wanted to introduce to you is the Retail Food Environment Index, the RFEI, and now there's a modified version of that, where you can look at the ratio of fast food outlets to grocery stores and farmers markets. And that ratio, what it does is it gives you a score for your community, and you can look at a lower score means there's more food deserts and more food swamps. So more fast food restaurants and not enough grocery stores and healthy outlets. So that's the bad news. But fortunately, when I was thinking about this issue, I was also thinking about how resilient our community is. and how despite these challenges and these poor environments, that there are families who seem to thrive. I've also thought about our street vendors, and you're starting to see a lot more fruit vendors in every corner. You know, those umbrellas with the colorful umbrella on top, and they sell mangoes and strawberries and watermelon and Jamaica and all these wonderful fruits. Well, that's a way that the community is really addressing some of these food deserts and taking matters into their own hands. So I'd like to invite my colleague, Karla Estudillo-Fuentes, to talk about the good news. And Karla is involved with this project that we're super excited about, and that is the Huerta del Valle partnership here at the Sac Norton Clinic on 3rd Street in San Bernardino. Karla?
Dr. Belliard, before we get into that, should we
Sure.
take some questions from the audience maybe?
Absolutely, yes.
Okay, why don't we do that? So this is the time to ask some questions of the audience. We have some questions coming in. And so I have one question here that came in that says, how does one's identities, whether racial or socioeconomic, influence food access?
So like I had mentioned, more than the identity, it is, we see these food deserts being more pronounced in poor communities and communities of color. So when we look at and we talk about health disparities, this is a very important part and a root cause. We call it the social determinants of health, right? What is it that shapes our health? And we see these disparities starting with food access, healthcare access, housing, education levels. Everything is working against certain communities at a much higher rate. And today, in a time of COVID, all these things are very important because we know where COVID has hit the hardest is in these communities where we have these comorbidities.
Right. We have another question that came in that said, do you anticipate the COVID-19 pandemic affecting food deserts? And if so, how?
That's an interesting question. In general, what COVID-19 has done is increase the amount of food insecurity, and I'll tell you why. Many of our families in San Bernardino and other communities like San Bernardino depend on the schools for the food for their children. Mm-hmm. So the moment the school closes, that food source is gone. And what we saw that happened in March and April and May is the food insecurity level went through the roof. 211, which is a phone number that you call for resources, they have reported that the two highest number of calls have been around food insecurity and rental assistance. So we have a community that's hurting out there, and yes, COVID has impacted the food insecurity significantly.
So, we have another question that came through, and number one, what I, when you talk about food deserts, is that people do not have access. And, access is a systemic problem that we have to intervene. This brings up another point on this question. How do you get people in food deserts to choose to eat healthy when they get used to bad options?
So starting with choices, all choices are not created equal. Mm. So I have a choice when I go to Stater Brothers to stay on the periphery of the grocery store, mm-hmm. or to go into the center where the other food is, mm-hmm. the not so healthy food. But that's a choice that I have. If I were to live in some of these food deserts, if all I have is a liquor store and an In-N-Out burger or a fast food restaurant within walking distance, that's really the choice that I have. Now, there is an issue with the addiction of fast food, and we know that's a real thing. Mm-hmm. Anytime you combine salt, sugar, and fat, you've got a highly addictive product. And we've all felt that, where we have an urging for something that has those ingredients. Mm-hmm. So I would say for us, it's more important to focus on the environment. So like I said, we can make the healthy choice the easier choice. and actually give people a choice.
Yeah. And also, to make that connection between what you eat and how you feel and your health, sometimes there's a disconnect there because we're in so survival mode, whether it's money, whether it's time, whatever, we don't make that connection sometimes. And so I think the choice helps you make that connection a little bit more, I think.
Correct.
Okay, so Karla, why don't we go to the second half of our presentation?
Great. Thank you, Dr. Belliard. Thank you, Dr. Moses. Dr. Belliard, if you could reshare the screen, that would be great. So hi, everyone. My name is Karla, and I am going to be talking about the positive sides of what we can do to address these issues that are both systemic and affect individuals. So we have a partnership with Huerta del Valle. So what you see here is the products of Huerta del Valle, which is the community garden and the community markets. Thank you. And so what Huerta del Valle is, it's a food system, it's a nonprofit, it's a social enterprise, but it's really more than just a community garden. Although there are 7 community gardens across the Inland Empire, each one of them is really catered to that specific community because it's led by that specific community. So the garden in San Bernardino that we're partnering with directly is not going to look the same as the one in Ontario, as the same one in Jurupa Valley. So each one is really characterized by the community itself that builds it up and that looks at and is able to advocate for its specific needs and its specific strengths. But all of the community gardens through Huerta del Valle have a couple of things in common that from Loma Linda we really like, because this is something that we know is inherent to those health choices that we're able to make. So it's about how do we empower the community to find their own power? How do we make those choices the easy choices? How do we create an environment where healthy community building is something that just happens organically? And so it's really more than just a place to grow tomatoes. It's really a place to grow community, grow relationships, improve your mental health. There's a lot of things that happen in community gardens, more than just what we sometimes see as a green space. And so this is actually an outline of what our community garden is. Our community garden is actually called El Jardín de la Salud. So it's called the Garden of Health. And so health is really that main tenet. And a lot of it's because of the partnership with Loma Linda, but a lot of it's also because the community itself has really found that health is something that they really want to dive into, learn more about, and be able to address in the community. So no one knows the community better than the community itself. And so that's why this specific outline is the way it is. So what you see here is really the aerial view of what our garden is supposed to be. Right now, we only have those bottom little plots. And so we have about 16 families signed up for this community garden. But our idea is that someday we're going to have 52 families. We're going to have a greenhouse. We're going to have accessible plots for someone that might need to come in a wheelchair. We're going to have composting, which is good for the environment. We're going to have a gathering area for whenever we can do that safely again, to have those gatherings, to be able to build up community, have workshops. And so this is something that the community itself said, this is what we want it to look like. When we think of our community garden, this is what we want. And again, it looks different than the ones in other areas of the Inland Empire because this one's specifically addressing San Bernardino. And so really, what is a community garden? Sometimes we think it's just some tomatoes, I water my plants, but the idea of the community garden with San Bernardino and the strength of Huerta del Valle already as a community garden social enterprise is that we're already addressing all of these different facets. So nutrition, community gardens, we're going to be growing vegetables, we're going to be growing fruit, so that will inherently increase the access to nutritious foods that perhaps the community didn't have before. Physical activity. If you've ever done gardening, and a lot of us have really picked it up during COVID, you know that it is something that will make you break a sweat, at least for myself. And so you're out there, you're gardening, and you're getting physical exercise. Even just walking around the garden, you're picking up mulch. This is something that will increase your rates of physical activity, and it's a safe space to do so. In communities, sometimes there's not really a safe space to go exercise outside. And so in the community garden, you feel safe doing that. Food insecurity, so again, families who may not have easy access to healthy and nutritious foods will be able to have better access to healthy and nutritious foods, even if they are not specifically part of the community garden. Some people might work a couple of jobs. They might not be able to come and have their own personal plot. They can still come to the community markets and be able to purchase organic produce at probably a third or a fourth of the cost that you do at any type of supermarket. And also Huerta del Valle and Loma have been doing, especially during this time of COVID, have been doing actual boxes of produce to families who might need it. And so that's something that we want to address is, yes, there are a lot of barriers, but the community has so many strengths as well. Community building. If you're in a community garden, you're going to meet your neighbors, you're going to water each other's plants, you're going to help each other out. And we've seen that already happening with people who were strangers maybe 3-4 weeks ago, already being friends, bringing each other vegetables from home, bringing each other ideas. And so that's something that just naturally builds, and that increases the safety of communities, that improves your mental health, that improves a lot of different things. And so that's something that we love to see. Environmental justice, so more green spaces, the better. So San Bernardino has a lot of warehouses, and a lot of large trucking companies coming through, and so that does decrease things such as the air quality, that does decrease the amount of green space that we see. And so really the idea of a community garden is tied inherently to environmental justice, because it's disrupting that narrative that everything has to be something that produces profit. Really, it's really about how do we produce something for the community, in the community, by the community. And so it's really that environmental justice piece of what does that mean? How can we access more green spaces? How is this healthier for our community? And so really, it really brings all of that in. And lastly, community health. That's what we're here for. And health looks different in different communities, and it can be something that we can address through this community garden. And we have some specific programs that we're really excited about. The one that we're going to tell you about is Produce RX. And so that's something that we're moving forward. And so what you see here is really the outline of what that program looks like, and then the community markets that go alongside it. And so what is Produce RX? So Produce RX is actually a prescription produce program that we're doing in partnership with Huerta del Valle and also the SAC Health System, which is in the same parking lot. So it's right across the street. It's not really extra work for patients to get there. And so we're going to try and increase the fresh produce access for patients with diabetes, hypertension, and obesity. So these are patients who may already have a difficult time accessing produce and vegetables. And so what we're going to do is really have them talk to their provider, have their provider recommend them for this program and say, hey, we want to be able to help you, because if you don't have the choices, health isn't always an individual choice. Sometimes it's a community environmental condition that forces you into those specific spaces. And so we want to say, hey, we're going to help you have more choices. And so the provider would be able to help them get into this program. We'll provide them with workshops about nutrition, about cooking, about all of these different things that have to do with health. And then they'll also be getting more exercise time with being in the garden. And then they'll also be getting food vouchers. So every 2 weeks, they'll get a food voucher, and those will be able to be redeemable at our community markets that we'll have once to twice a month. And again, the cost of all of the fruits and vegetables that we have is significantly lower than anything you would find at a supermarket, and it's organic and locally grown, which is better for the environment and for ourselves as well. And so that's something that we're taking an idea, how do we address health, and really putting it in all of these different pockets that are already operating, and then really bringing it back to the person. And so providing that person with more choices. And so here's what we see. It's a community-led and community-built effort. What looked like just a brown, desolate space has in a couple of weeks just really transformed into a space where there's vegetables growing and there's people helping each other out. Right now, especially, gardening is one of those things that we can do safely, maintaining distancing, but still being able to talk to your neighbor and ask how their plants are doing, how are their chili peppers growing, how are their tomatoes going. And so it's something that we really love to see, all of the work that comes together into a community garden. And so perhaps the question is, how can I get involved? How can I support this project? What is my next step in being part of a community garden? So with the community garden in San Bernardino, you can specifically have your own plot. If you live in an apartment like I do, you might not have space in your backyard to start a garden that's going to produce more than 1 tomato or 2 tomatoes. And maybe that's not enough for you. Maybe you love your vegetables. And so you can actually have your own plot at our community garden. Like I said, we have 16 families right now, and we're open to about 50. So if you want to have your own plot and you want to do that, or you want to sponsor a plot for a family, that's something that you can do. You can actually come and volunteer if you just want to spend a couple of hours laying down mulch, helping. Maybe there's families who are smaller families, or we have some plots who are maybe just like one older woman, and you can come and help them set up their area. You can come and help with the irrigation system. So if you want to just come and volunteer, you can. You can also be part of our community supported agriculture program. So Huerta del Valle has a program where you can order fruits and vegetables, and they can be brought here to Loma Linda every other Friday. And so you can get a small box, which is for about 2 people. You can get a medium box, which is a little larger, maybe 4 people. And if you really love your vegetables, like I know Dr. Belliard does, you can have the large box, which is supposed to be for a larger family, but you can just do it if you really love vegetables and fruit. And so that's a way that you can support the garden itself and help keep it running, because it is a nonprofit, it is a social enterprise, it is really mostly volunteer run, and it's not really something for profit. So you can support it in that way as well. You can donate, like I said, your time, or you can donate resources if you have them. Currently, we are requesting funding from the community for a community mural that has already been designed by a local artist. And so we're actually going to have those local artists come. Families are going to come and paint that in the next couple of weeks. And so if you'd like to support, the flyer is right there. In really big letters is our URL, so you can go to that link and help support us in that way. You can donate seeds, you can donate trees, you can donate plants, you can donate tools. So really, if you have a resource, we probably need it. And then you can also just spread the word. Maybe gardening is not something that you're passionate about, but it's something that maybe someone you know is passionate about. So you can always share this information with someone and let them know, hey, there's this community garden coming near you, and this is a way that you can get involved. So if you have any questions about this, I did put my email there, so you can always contact myself as well. But we're really excited about this project, and we know that gardening is more than just some plants. It's really about community itself. So thank you.
Well, that is fantastic. Thank you, Karla. So we want to make sure that everyone got your email address on where to send things. So do you want to give them your email address really quick again?
Yes. So my email is kfuentes, KFUENTES @LLU.edu.
So a couple of questions. We have so many questions coming through, but I also want to know, how does someone go about or qualify to have a garden or a plot?
And so to have a plot, you just have to show up to the community meetings. And so our community meetings are every Thursday at 5 p.m. And so really being part of the community garden is about wanting to be part of a community. So once you come to a meeting and you express interest in wanting a plot, you sign our social contract, which is really, I'm going to come, I'm going to volunteer, I'm going to look after my plants. And then there is a small fee, but a lot of families that we have right now are not able to pay it. And that's not a problem. We want it to be as accessible for everyone. So if there's a family that can't pay, that's not something that we say, hey, you can't be part of the garden. No, absolutely, you can still be part of the garden and just be on the same level as everyone. And that's really it, just showing up.
Okay, well, that seems simple enough.
Yeah.
Another question I had, if we have some of our viewers that are watching this and want to support, how much does supporting one plot, how much is that?
So supporting one plot is $35 a year. And so that's $35 for a year, and that includes water, that includes compost, that includes mulch, we have seeds. So really the community members don't have to put very much of anything out of pocket. And so that's what we want to do, is we want to increase access, right? Because some people might not have $200-300 a month to drop on some vegetables. So it's really accessible. It's $35 a year if you want to sponsor a plot. That's really it.
We have a question that came through. I'm sure this is very hard to measure, but it says, what effect has community gardens made on chronic disease and food deserts? Have there been any studies that show positive effects?
So we have seen some healthcare systems across the country that are tapping into this. That's why we're super excited about the Produce RX program. because once patients start getting involved with the garden, the question about when you're used to eating fast food, you develop a taste for it. Well, the worst way to get somebody to start eating, fruits and vegetables is to get something that doesn't taste great, like a tomato from the store. It has no comparison to a tomato grown in your own garden, or a cucumber that, is crisp and snaps and you can just eat it like it is straight from the garden. So there is some work that has looked at both food deserts and community gardens. And also the impact on chronic disease, and we're happy to share some of those resources with whoever is interested.
That's great. Now, if there is any of our viewers who are saying, well, this is fantastic, look at the great work that they're doing, and I love this, is it Produce RX? I love it. It's fantastic. How do they get started? What are some of the steps that need to take to maybe start something like this in their own neighborhood?
Do you mean the community garden itself or the produce prescription program?
Either one or both.
For the community garden, really, it kind of depends on what your community also wants, right? I think the biggest part where it comes to a community garden is finding community members and being able to say, what is it that we want to see in our community? Because as I mentioned, different communities will need different things, and they'll have different spaces, they'll have different needs, different strengths. And so you really want to look at the strengths of the community and the needs of the community second, and then be able to build off of that. And of course, it's always, how do we find partners? How do we find all of these different organizations that maybe they've always wanted to start a community garden, but they didn't think there was anyone in their community that was willing to spearhead it. But really, most of the leadership that I've seen that is really resounding comes from the community itself. Sometimes we think it has to come from institutions or it has to come from places of academic endeavors, but most often it comes from the community itself, because they're the best mobilizers of their community.
And that's the beauty with this model, is it's very grassroots, because we've seen a lot of community gardens come and go. But this model where the community designs the garden, they set up their mission statement, their values. I mean, it's very organized, and it starts from the grassroots up. The Produce RX piece, I think it's a matter of connecting these kind of resources, the community gardens, to healthcare. And I know there's a lot of providers that are frustrated with their patients coming back for the same thing over and over, and they're looking at alternatives. So this Produce RX model is really growing across the country.
No, that's great. Well, I want to say kudos to both of you on a fantastic project, and well done. I'm so excited seeing those blueprints of the gardens, and this is fantastic. And I hope it inspires all of us to kind of get involved in something that makes a difference on such a wonderful level of, you growing something from a seed to a plant to a harvest. I mean, it can be very rewarding work. So thank you both for being here. And I want to make sure that everybody it's Fuentes at llu.edu. And is there a number that they can call potentially as well if they are interested?
There is a number they can call. As a new employee, I just still need to learn it. So let me look at the business cards. All right.
I can give you a number, 909-558-7754. 909-558-7754.
So again, thank you, Dr. Belliard and Karla, for being here today. And I want to thank you for being here as our viewer, because this is what Wellness Live is all about. We learn about health and we get energized to go do something about it. And I want to mention that we will be back again live September 30 right here. So we look forward to seeing you then. Again, I want to thank my guest speakers, everyone in the studio, and thank you for joining us on this COVID edition of Wellness Live. My name is Dr. Olivia Moses, and I look forward to seeing you next time.